Let's talk about peptides because half of you lifters out there are stabbing yourself with these peptides, wondering why your shoulder still hurts. It's not the peptides' fault. It is honestly because you haven't figured out the root of the issue. I'm Dr. Kaytlyn. I help lifters fix pain without quitting the gym. So if you're new here, make sure you hit subscribe, and if you want my pain-free PR playbook, grab it below in the description. So let's talk about what peptides can do and what they absolutely cannot do. Okay. Now, I get the appeal. They promise faster healing, less inflammation, and honestly, maybe even can promote superhero recovery. And yeah, they can be cheaper, okay, compared to months of rehab or MRIs or actually learning how to move right. Because if I know one thing about you, if you're on this channel, you are someone who takes action and you are ready to hit your next pain free PR. However, the thing about peptides is they can help with tissue repair. They can help kind of nudge you along. But if you're not actually addressing the real reason, the mechanical reason why your joint, your shoulder, your muscles are pissed off, maybe that's the way you move, some kind of imbalance, maybe some kind of like strength or mobility issue, if you don't have the control that you need, you are just patching holes in a sinking ship. I know that that's not fun to hear. However, you know me. This is how I roll. I'm going to tell you the hard truth, even if it doesn't feel good. Okay. You cannot out inject some kind of mechanical movement fault. Okay. You can't out supplement shitty recovery. You can't keep treating the symptoms and expect the problem to disappear, because peptides might buy you time. They might help you feel better in the short term. But if you keep neglecting the root cause of the issue, you are just going to land up here in 6 months again, sore, frustrated, out a few $100, and honestly feeling like you're broken and nothing will actually fix you. That is one of my problems with these things, with these tools, with these gadgets, is that they not only don't work, but they can also set you up for feeling like you cannot get past the shoulder pain. It's the same reason why I hate shitty PT, shitty chiropractic care, shitty massages, like anything like that. If they're just like treating the symptoms without actually attacking the root of the issue, those things can make you feel broken. And if you don't believe that you're going to get better, you're not going to. And so by the time you get to me, you're already going to feel like, hey, I don't even know if this is something that can be fixed. And you're not going to have as good of an outcome. There is such thing that you need belief in order for this to work, no matter what it is, no matter who you work with. So these things can end up negatively impacting your mental state when it comes to belief about recovering. Back to peptides, because that was a completely different tangent. But peptides, again, they can help with healing. However, if you're not attacking the root of the issue, it's just going to be a band-aid, right? It's like trying to patch a leaking pipe by just slapping a piece of Scotch tape, not even duct tape, Scotch tape on the hole wherever the leak is, and then just focusing on mopping it up, mopping up the symptoms of the actual leaky pipe. And so we want to make sure that we are actually fixing that. Otherwise, you can inject, you can do all of these things, but you're going to end up in the same spot, and that is going to be frustrated, confused, and by golly, you just want to lift, and you want to lift well, and you want to lift heavy, and I get it, okay? So if you are someone who is dealing with shoulder pain, instead of just jumping to peptides, which is very, very enticing, I get it, I want to zoom out so that we can zoom in. I'm going to illustrate this with a client example. I worked with someone named Austin, okay? He came to me. He's a very smart guy. He's very well researched. He knows what he's talking about. He is an Olympic weightlifting coach at the collegiate level. He knows his way around the gym. He knows his way around strength training. However, he could not figure out his shoulder. So we hopped on a call. I was asking him some questions, right? Like, I want to understand. I want to like immerse myself in this so that I can truly get a good sense of what's going on. So we were talking and he goes something about, yeah, like my shoulder hurts when I'm doing snatch. It's not as bad when I'm doing jerk, but for some reason, snatch is pissing it off. Okay. So I'm like, all right. Well, when's the last time you did a snatch without a lot of pain? And he's like, well, actually, like 2 days ago, I did a power snatch and got my head spinning. Okay. So I was like, when's the last time you did a snatch with pain? And he's like, it was like last week. I'm like, okay. I was like, is this common? Like power snatch doesn't hurt, but snatch does. And he's like, yeah, actually, like he's like, that's weird. I've never really like put that together, but yeah. So we did the assessment, and I like to look at multiple areas when I'm doing an assessment. So we ended up looking at his hips and his ankles, knowing how dynamic lifting is. And we were like, okay, so hips are really tight. And when we look at your power snatch versus your snatch, you're having to get so much more shoulder motion because of something that is happening at your hips and your ankles. So we cleaned up the ankles, we cleaned up the hips, we improved that mobility, and guess what? Shoulder pain went away with very little things to do with the actual shoulder, right? We did some T-spine work, we did some shoulder blade stuff, but we didn't do a lot on the shoulder itself. We just focused on the hip and the ankle. And this is a very good example of if you just treat the symptoms, you are setting yourself up for recurring pain and a roller coaster of pain, right? No amount of rest, no amount of peptides, no amount of gadgets will fix this if you think the problem is a shoulder problem, when in reality, in Austin's case, it was coming from hips and ankles. And so we want to make sure that we are not just treating the symptoms. We have to go full in on fixing the root cause. This is truly the only way. So for him, if he would have tried BPC 157 or TB 500 or Samorlin or any of these other peptides out there, he probably would have been confused, frustrated, feeling like he could not get to the root of the issue and like he just couldn't get past the injury. He actually went on to go lift at nationals and do quite well because he actually fixed the root of the issue and has had no problem since. So that is it. It is truly the most important thing to know where the pain is coming from, why it's happening, and not just mask the symptoms. So, if you want help pinpointing the root of your issue, if you want me to take a look at how your shoulder's moving, if you want me to take a look at how your bench looks, your shoulder press, whatever movement that's causing you pain, send me a DM on Instagram and say audit. I'll take a look at this. We'll see what we can figure out for you so that you can live pain free. And I'll help guide you on what the next best step is for you. If you have any questions, drop them below. Make sure you like and subscribe, and I'll see you on the next one.